Hi, I'm Dr. Jonathan Clark. I'm a board-certified chiropractic neurologist. My practice is made up primarily of chronic patients like yourself, and I pride myself on being up to date with the latest breakthrough treatments that are out there. I consult with over thousands of doctors, or rather over 1,000 doctors at lifechangingcare.com, and I've been trained by the author of the book, Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? By Dr. Thyroid. Anyone that's suffering from a thyroid condition, I recommend that you get this book. It is phenomenal and instrumental in showing you how to properly learn and treat your thyroid condition. So some 20 million Americans are affected by thyroid disorders. That's roughly 1 in 13 people. And more than half of those people are really unaware that they've had a thyroid problem because it frequently goes undiagnosed, unfortunately until it gets very severe. According to the National Women's Health Information Center, 1 in 8 women are going to experience a thyroid disorder during their lifetime. So let's talk about some of the symptoms of these. And some of the symptoms of a hypothyroidism or slow thyroid is fatigue, often feeling tired, sluggish, cold feet or hands. You require excessive amounts of sleep to function. You gain weight very easily. You have difficult or infrequent bowel movements. People have told me also that no matter how many hours they log on the treadmill, they still just can't lose weight. You might be depressed or suffer from depression. You lack motivation. You suffer from morning headaches that maybe they'll wear off as the day progresses. You suffer from thinning of the hair. That's a common thing with hypothyroidism. Or excessive hair falling out. You have dry skin or scalp. Maybe you suffer from mental sluggishness. This is all symptoms of hypothyroidism or slow thyroid production. Symptoms of hyperthyroidism. You suffer from heart palpitations. Maybe you suffer from inward trembling. You have an increased pulse even at rest. You're nervous and emotional. You suffer from insomnia. You suffer from night sweats. You have difficulty gaining weight. Hashimoto's thyroiditis is an autoimmune disorder in which the patient's immune system attacks the thyroid gland. In fact, an autoimmune condition is basically when the body's attacking its own tissue. Patients that suffer from Hashimoto's are going to experience a combination basically of all the above symptoms. So let's talk about the thyroid gland itself a bit. The thyroid gland runs our metabolism. It's the gas pedal of the body. Thyroid hormones have direct effects on most organs, including the heart, which beats faster and harder under the influence of increased thyroid hormone. This is why heart problems can often accompany chronic thyroid problems in women, and perhaps why heart problems are more common in women under the age of 50. T3, that's the more biologically active hormone. It's more important for cellular function. And in fact, most of your T4, the other kind, 80% roughly, is converted to T3 in the body's peripheral tissue. So T4 is just a precursor for the more active hormone T3. In fact, about 20% of your T4 to T3 production takes place in the gut. So if you have a problem with digestive issues or gut infections or parasite or any kind of inflammatory process, 20% is a large portion of your thyroid hormone that's going to be interfered with. So one of the problems in some thyroid disorders is that you may have trouble converting T4 to T3, like we just said. So have you been checked for this? This can create a deficiency of T3, disrupting the body's ability to properly regulate metabolism, leading to specific symptoms. There are some clinicians that are treating thyroid conditions with iodine. I really don't recommend iodine in the treatment of thyroid conditions, and according to the author of the book, by Dr. Thyroid, using iodine is almost like throwing gasoline on a fire for a thyroid condition. So really what makes us different from every other doctor that you have seen? Well, we treat you metabolically and we treat you neurologically. You're on this website right now because you or someone you love are suffering from a thyroid disorder. And I'm here to tell you that no stone is left unturned to determine the exact cause of your problem. And I guarantee that no one has told you what I'm about to tell you. I'm going to address what makes our program unique and how we successfully support thyroid issues. So we use specific metabolic and neurological protocols, specific metabolic testing and treatments, such as sensitivity testing. We use sensitivity testing to determine if you have a sensitivity to gluten. Gluten is a substance that's found in wheat, rye, and barley. If you have a sensitivity to this, this is making your condition worse. We're looking for sensitivity to milk, eggs, yeast, soy. Again, folks, if you have a sensitivity to any of these food groups, it can cause more inflammation in your body and increasing the problems with your thyroid condition, making your thyroid gland worse and your brain and inflammation worse. Here are some of the symptoms of these sensitivities. Chronic pain, fatigue. This is something we see in our office every day. Frequent indigestion, bloating after eating, frequent loose bowel movements, or the opposite, constipation, mouth ulcers. The only way to find out if you're suffering from any of these tests, or these sensitivities rather, is we have to run the test. We do complete blood panels in here. We use specific blood tests, a complete metabolic panel. We do a lipid panel, a CBC or complete blood chemistry with autodifferential. We can assess your adrenal glands, your stress gland, your liver, your kidneys, your red and white blood cells, gut function with these above lab tests. All can be affected with chronic health conditions. By addressing any problems with your adrenal glands, blood chemistry, or gut function, we can help you to heal faster. This also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. So what are the tests of the thyroid we do? Well, obviously, we do a TSH, which is a thyroid stimulating hormone. This is the message sent from the gland in the brain, the pituitary, to the thyroid. Normal ranges, lab ranges for this, run from 0.5 to 5.5, 0.45 to 4.5. They can vary from where you are in the area. We don't look at lab ranges, folks. We look more at functional ranges. Okay, lab ranges are very broad. Functional ranges determine health. Okay, so our parameters are much more narrow. And once you start to get outside the functional ranges, you start expressing symptoms. But what happens is, unless things get really, really drastic and start getting outside the lab ranges, you usually aren't diagnosed. And unfortunately, that's most of us that fit in these categories. And there's a lot of destruction of the gland going on at that point. So when a patient comes in and tells me, well, I've had the lab test, my lab tests are normal. Again, it varies from location because the lab tests here, the lab ranges here, are different than they are 45 minutes down the road. We need to assess functional or health ranges. We look at free T3, an important hormone produced by the thyroid gland. This is the more biologically active hormone of the thyroid. We look at free T4. This is another important hormone produced by the thyroid gland. We look at TBG, or thyroid binding globulin. This test measures the amount of proteins in the blood that transport thyroid hormones to the cells. If we have elevated testosterone, it can lower our TBG levels. Elevated estrogen can raise TBG levels. So both can produce hypothyroid symptoms like we talked about before, the sluggishness, the loss of hair, the fatigue. We need to check your thyroid antibodies. If you have an autoimmune condition, in fact, roughly about 90% of hypothyroid patients are Hashimoto's, meaning an autoimmune thyroid. You need to have your TGB and TPO antibodies checked if we suspect an autoimmune condition. We need to check your total T4. This is a reflection of how much total T4 hormone there is in the blood, both bound and unbound. We need to check your FTI, or free thyroxine index. This is an estimate of how much thyroxine is in the blood. We need to check resin T3 uptake. This test measures the unsaturated binding sites on the thyroid proteins. We need to check and see if you have an autoimmune condition. There's two parts to your autoimmune system. We basically have a T-weight Th1 or a Th2 system. So oftentimes when we have an autoimmune condition, these things can get out of balance. So Th1 is your T cells, your macrophages. Th2 is your B cells, and that things that make antibodies. So if you're autoimmune, we need to rebalance this system. But we also need to find out what's causing the imbalance. Is this from an active antigen, such as a yeast overgrowth, parasites, infection? Or is this from a dysregulation? Abnormal blood sugar fluctuations will affect the thyroid gland and disrupt it. Adrenal stress problems, any possible anemia. What's driving this imbalance in the immune system? We can also look at what's called an ASI, or adrenal stress index. This is the adrenal gland, the area that sits above your kidneys. It's a salivary test, kind of like DNA testing. And basically it's your stress gland. If you've been under chronic stress, or if you've been having insomnia or any kind of diabetes or blood sugar issue, this is a must, because this is going to measure your cortisol levels, and this has a lot to do with how your thyroid gland functions. So as you can see, it's not just one thing. The thyroid is dependent on many, many other areas in the body, and if you're having problems with those other areas, it's going to affect how your thyroid gland functions. We can look at hormone panels. We can check hormone panels to determine if a patient suffers from low testosterone in males or low estrogen or progesterone levels in females. Symptoms related to decreased hormones are going to be depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain. But again, we need to find out what else is driving this system to be offset, because everything is related. So the brain and the thyroid have a connection, so we need to increase frequency of firing of the brain or improve what's called our HPA axis, or hypothalamic pituitary adrenal axis. Hypothalamic pituitary adrenal axis. Okay, so we use specific neurological testing and treatments. We utilize what we call brain-based therapy. We might use vibration therapy, Vibration therapy fires the back part of the brain called the cerebellum. The cerebellum controls all those postural muscles in your spine. We might use auditory stim, visual stimulation where you see different flashes of light, olfactory stimulation or smell therapy. Whatever we can use to find that weak area of the brain and increase the frequency of firing of that area. We're the only clinic in the area that has the Avicena Class 4 laser, which is the highest powered laser on the market right now. Laser therapy basically helps heal tissues faster and helps with chronic pain. We might use non-surgical spinal decompression, which is a machine we use to help basically relieve disc pressure and open up the compressed areas between the joints in the spine. This also increases the frequency of firing of the brain. We're the only clinic with the active therapeutic movements machine, or ATM2. This is the first device in the valley that focuses on motion impairments, chronic neck, mid-back, low back pain. We can see immediate results with this machine. We utilize interactive metronome. This is a computer-based program that uses visual, auditory, and motor stimulation to increase the frequency of firing of the brain. You can go to interactivemetronome.com for more information. So it's basically measured in milliseconds, and it works with the feed-forward, effort, copy, feedback system of the brain. So once we've run these necessary tests to determine what's going on in your specific condition, then we can successfully treat you via proper neurological and all-natural nutritional protocols. So you really need to ask yourself the following questions. How has your thyroid condition affected you really up till now, with your relationships, your finances, your family, and other things that you like to do? What is this costing you in time, money, happiness, and even sleep? Where do you picture yourself in the next 1 to even 5 years if you don't do something about this? So what is this really worth you if we can improve your condition? Well, hopefully this was beneficial in shedding some light on thyroid gland for you, and I wish you the best of luck in the future.